How do you overcome overthinking? I think the first step that I would want to do is to gain an understanding of how you define overthinking and how do you differentiate it from normal thinking. What metric do you use? Do you look at the time you spend thinking about something? Do you look at the negative emotions that are provoked as a result of those thoughts that you have? Meaning, you experience a bit of anxiety, maybe a bit of a depressed mood. Do you experience discomfort? Do you experience conflict internally? Or is it the consequence of the overthinking, such that now, because of the overthinking, you're experiencing lack of attention, inattention symptoms, or you're experiencing lack of concentration, or it's affecting your output, it's affecting your productivity, it's affecting your ability to be effective at work? Is it affecting perhaps your personal relationships, such that you're supposed to make a decision on something, but because you're overthinking about that thing, you're delaying the making of that decision and it's affecting your relationships? So I'd want to understand what exactly makes a behavior overthinking and not normal thinking. The other thing is that different personalities have different ways of engaging in a thought process. So, for example, people who are high in neuroticism, they tend to spend a lot of time, they tend to put a lot of forethought in things that they want to do or they have to do. And so for them, perhaps their duration might be longer than for a person who's extroverted or introverted. They might have difficulties rising up to the occasion of spontaneous activities, neurotic people, whereas an introvert or an extrovert might find it very easy. Yeah, so if there's a background of a personality dimension that predisposes you to perhaps things like anxiety and overthinking and depression, like neuroticism, then I'd want to understand, when did you start noticing it? Because if it's always been there with you, then it's not necessarily a problem that we need to sort out, but rather that's the way that you process situations. Or is it something that began maybe 2 years ago, 3 years ago? And what events were happening around that time that perhaps precipitated these episodes or this new behavior of you overthinking? I'd want to understand all those things, because once you understand what the overthinking symptom is associated with, then you're able to solve the problem. It's like, for example, a person with malaria will have a headache, but the Panadol will only help with relieving the headache temporarily. It won't treat the malaria. And so here, overthinking is the headache for the malaria. So you want to understand this overthinking is associated with what symptoms, so that you can be able to treat the problem itself and not just one small symptom, because it will continue happening since the problem is still there. I hope that helps. So understand first this overthinking. What is it associated with? Is it associated with depression? Is it associated with anxiety? Does it come perhaps with the bipolar depression? If you are bipolar, does it come with a personality disorder, such as maybe borderline personality, or histrionic, or narcissistic, or antisocial? What is the bigger picture, such that this overthinking is just a small symptom that you're seeing?